Okay, hello everybody, I'm Chloe, I'm 20 years old, I have fibromyalgia, and I just started this video, got about 5 minutes into what I was saying and realised that I wasn't recording, which is really annoying because I'm actually a bit out of breath and exhausted from all the talking now, so this video is not going to be as good, but nevertheless, I'm a bit late for Fibromyalgia Awareness Day, and that's because I only just made my channel this morning. I would have made it yesterday, but I was just too ill to go through the whole process. It wasn't going to work, so I'm making the video today. I think it's really important to raise awareness of fibromyalgia because no one really knows what it is. The reactions to my diagnosis have been quite strange. Most people just don't know what it is at all. I say fibromyalgia and they say and yeah. So yeah, but those who have heard of it tend to have misconceptions. When I got my diagnosis, I told my grandma and she said, "So you're going to have steroids now?" And I was like, no, because I don't have any inflammation. Inflammation isn't generally a part of fibromyalgia, so steroids aren't indicated for it. Some fibromyalgia patients do benefit from steroids, but no, not generally something you do for fibromyalgia. So I had to explain to her that it wasn't an inflammatory condition, it's neurological. It's actually kind of how doctors can tell that it's more like fibromyalgia than something like rheumatoid arthritis, is that obviously there's a lot of inflammation in rheumatoid arthritis and not in fibromyalgia. So I had to explain that, and also in the medical community it's not that well known. I started seeing doctors in 2006 for the pain, and the exhaustion kind of followed a bit later, and it wasn't until 2011 November that I actually got a diagnosis. And that was with a pain specialist that we saw privately who actually does research on fibromyalgia patients. I didn't know that when I went to see her, but that's what she does, and so she knew what I had immediately. It was really obvious to her, and you know, from my notes and everything, and from the examination, it was just so obvious, and I fit the diagnostic criteria absolutely perfectly. And even with all of that, it took 5 years for me to be diagnosed, and it was only when I saw somebody who does fibromyalgia every day that they recognised it. And I think that's really quite bad. I kind of think maybe if I'd known what was wrong with me sooner, I could have managed it better. I maybe wouldn't have gotten as bad as I did at times. But I have a diagnosis now, and I'd just like to raise awareness so that other people with fibromyalgia can understand a bit more what's going on with their bodies. People who think they might have fibromyalgia but are undiagnosed, as so many of us are for such a long time, you know, can see some experiences, and you know, the awareness is there for them to maybe suggest it to their doctors, or you know, see if their experience matches. And also, doctors need to know about it. Doctors need to understand it. And any doctors who still think that it's not real should be slapped in the face, because it is so established in the scientific community, people who do research on it, that it is completely a real disease. Those doctors who stand up and say, oh, it's not real, are just kind of stuck in the 1980s when they did their training, and fibromyalgia wasn't really a word that was used then, and so yeah, they're just kind of stuck behind. They haven't kept up with their education, and they're being arrogant. So I just think they should be slapped in the face. That's my opinion of doctors who don't believe in fibromyalgia. So yeah, so that's why I think awareness is really important, because there's just not enough of it, not enough people are aware. I mean, people spend a lot of time trying to raise awareness of breast cancer and things, and you know, we're all aware of breast cancer, we're all aware of heart disease, and yes, they're important issues, but there are other issues like fibromyalgia, like the reality of ME, like Ehlers-Danlos syndrome, like POTS syndrome, all of those things, chronic Lyme, that are just not in the public eye enough, that people are not aware of, where awareness is really important to raise, and I think we really need awareness of fibromyalgia. So I've already told you that it took me 5 years to get diagnosed, and it did, and I was diagnosed in November last year, and now I'm here in May 2012, and I've come back from my leave of absence. I'm back at uni. I took a leave of absence because I was too sick and I failed a lot of exams, and I'm back now. I see pain management specialists now, which is great, because I tried to fight to get a doctor who understood you know, what was going on with me for a long time, and I saw a rheumatologist who didn't know what was going on and couldn't help me. And my GP didn't know what to do with me at all, and so eventually I got to see a pain management specialist, which is great. My pain management specialist is absolutely wonderful, and she treats me like an intelligent human being, which a lot of doctors kind of don't. And so we discuss, and she tells me about the studies of, before she gives me a drug, she doesn't just say this might work, it might be in order, it might not work. She talks me through the studies that have been done, and we discuss the results of the studies, because I'm studying biology and she knows that. So we have a conversation. I really feel like a partner in my healthcare with her, so that's really good. And the nurses at the clinic are also brilliant. I went to my second appointment in April, and it was only my second appointment. I walked in and the nurse said, "Hi Chloe, oh, you've changed your hair," and I was like, wow, that's brilliant. I've only been once. It was a pretty dramatic appointment when I came. It was very long, when we talked about all the problems I have and all the things we've tried and how they haven't worked and all the rest of it. But yeah, so that's really good, and I'm on the waiting list for an intravenous lignocaine infusion, which is as dramatic as it sounds. Lignocaine is the local anaesthetic that dentists use when they're going to pull a tooth out, and I'm having that infused into my system. I have to go into hospital as a day patient for that. I have to be hooked up to an ECG, and I'm monitored because the lignocaine is a sodium channel blocker, and that means that it can slow down your heart rate, it can cause fits, so it's a bit scary, but I thought about it for a good number of months and came to the conclusion that I need to do something about the pain. So I'm on the waiting list to have that done. I'm waiting for an appointment. I'm kind of apprehensive and also nervous and excited about getting the appointment. I don't know what will happen when I get the appointment. I'll probably freak out and be terrified, but I want to have that done, even though it's scary. I've never been admitted to hospital before. I mean, it's only as a day patient, assuming I don't have any serious side effects from the treatment. It's only as a day patient, but I've only ever been an outpatient before, so it'll be an interesting experience. I'm really out of breath and knackered now. I've been talking too much and too fast, and I'm having a very out of breath, kind of palpitaty kind of day. So, I mean, I could talk about the list of symptoms of fibromyalgia, the things fibromyalgia causes, but people are not a list of symptoms. I am not a list of symptoms. I could list my symptoms, but we'd be here for half an hour and you're probably bored of this video already. So, I'm me. I have fibromyalgia. I deal with fibromyalgia. Sometimes I don't deal as well as others. My life is very different because of fibromyalgia. I'm very different to other students. I don't get out so much. I don't manage to do as much studying. I miss lectures. I find life very different. And I think that's really what fibromyalgia causes. It causes difference. And that's where we really need people to understand what fibromyalgia is, that it's real, that it's here, and that people have it. And then it causes such an astonishing array of symptoms that if somebody says that because of my fibromyalgia I can't do X, that's a reasonable thing for them to say. Because it really could be. I mean, if they say something like, I can't go for walks in the morning because the bright sunlight messes up my fibromyalgia, that's a perfectly reasonable thing to say. It's not true for me. I do struggle with bright lights, but that's not true for me, but it's probably true for somebody with fibromyalgia. We are all very different people with fibromyalgia. Some people have far more fatigue, and other people have far more pain, and other people have far more of the other assorted symptoms that come with fibromyalgia. So I'm not going to list the symptoms. We haven't got time. But we exist, and we're people, and we need people to accept that our disease is real. And just listen to us. Listen to us. No one else. Don't watch my video and see my limitations and apply them to somebody you know with fibromyalgia. Listen to the individual and what they say about what they can and can't do, and accept it. Don't push them. Never push them. Never make them feel guilty for not being able to do something, because it's not their choice. And it's really sucky when you have to say, no, I can't come out tonight. I missed my friend's 18th birthday party because I couldn't get there. I was in too much pain to walk that far, and I felt so horrible, and my friend was fine with it. But had she gone, oh, you know, it's my 18th birthday party, you've got to come, this is so unfair, you know, I would have felt awful because I really wanted to be there, but I just couldn't. It wasn't my decision. So never make people feel guilty about not being able to do something, because we don't choose to have fibromyalgia. If you could take it away, I'd offer to have your babies. If someone could take it away, that would be the most amazing thing ever, but they can't, and so we've got to live with it, and we need the people around us to live with it too. So that's what I have to say on fibromyalgia. I'm going to make more videos about my symptoms, about my days. I'm intending to get really into this because I've been watching other people's videos about living with chronic illness, and I found them really interesting, really inspiring. It helped me over the last few days to not let myself get too lazy. I mean, when I've been feeling really awful over the last couple of days, other people's videos have helped me to make sure that I do get up and move around as much as I can, rather than just going, I feel awful, and staying in bed. So had I not been watching the videos, then on Friday I probably wouldn't have showered, I wouldn't have done anything, but because I was thinking, no, I've really got to do as much as I possibly can, I did take a shower, and it was hard work, it was hard going, and I suffered because of it, but I took the shower and I felt better that I'd achieved something. So I'm going to keep making videos, and hopefully they'll be shorter and more specific and more concise than this one, and I'll have an opening sequence and an ending sequence that I want to put on. So thank you very much for watching. Talk to people about fibromyalgia, find out about fibromyalgia, watch other people's videos about fibromyalgia, and remember that the big thing is that if you don't know, ask. Never make assumptions. Never ever make assumptions about somebody in their condition, because if you get it wrong, it can be really distressing for the person. Okay, so thank you very much for watching. I'll see you again soon.